Hi everyone, good afternoon and welcome to GoLocal Live. I'm GoLocal News Editor Kate Nagel. Thanks for joining us in a new downtown studio with our guest here, Dr. Phil Chan, Associate Professor of Medicine at Brown University. Doctor, thank you for joining us today.
Thank you for having me.
Very interesting topic, the role of misleading ads on social media now pertaining to HIV and specifically the HIV PrEP program, which Dr. Chan is very involved with here, actually starting up the program in Rhode Island, but facing some sort of misinformation campaign, if you will. So I'm going to back it up a little bit. Before we even go into the ads, Doctor, tell us a little bit about your work and specifically the PrEP program.
Yeah, so PrEP stands for pre-exposure prophylaxis. It's a pill daily which prevents HIV infection. It's a game changer in addressing the HIV epidemic, and in fact, it's one of the pillars on how we're going to end the HIV epidemic. So again, it's one medication, it's a single pill you take daily. We focused a lot in Rhode Island and across the US on really doing a lot of outreach to at-risk populations, and unfortunately, most of the HIV epidemic is still focused on gay and bisexual men, so that's where the majority of our outreach has been.
Okay, so when were you made aware that there was this information out there, patients coming to you saying, oh, I saw this ad, should I have concerns? When did this really arise?
Yeah, so during this past year, I started having some patients coming in and saying, hey doc, look, I've seen some advertising, I've heard some things about kidney toxicities and bone effects, and it's not really a concern, is it? And these are people that are already on PrEP. These are well-educated people, people with good access, and you know it's been concerning to them. And I just worry about certainly for people that have who are not on PrEP and have heard some of these commercials.
So talk with us a little bit about that. You know, are there potential side effects on PrEP? And talk with us a little bit maybe about the disconnect between what's being put out in social media and what the actuality is.
Yeah, so what I like to tell my patients is that you know, any medication has any side effects, and we don't always know what they are, and that they can affect people in any way. It's known that PrEP, so the medication is called tenofovir disoproxil fumarate and emtricitabine. I know it's a mouthful, and there's a second medication that just came out. And we know from studies that about 1% or less of people can have some effect on their kidneys.
Okay.
And we can see some effect on the bone mineral density level. Now, the thing is, we don't often see a lot of clinical complications, so it's less of a concern, and we monitor it. So the ads that we've seen are totally blown out of proportion, and we're worried are really steering people away from this important public health intervention.
Now, would those be some of the things that when you hear a drug ad, oftentimes the disclaimer at the end of commercials tends to be rather lengthy, just saying there's a potential this could happen, but these ads are really taking it to that level of if you've had some sort of issue, it definitely relates to this drug, and from what you see that doesn't jive.
Yeah, it's sort of, in my opinion, it's the most dangerous type of ad because it does have some truth. There's definitely some truth, but it's certainly blown out of proportion and really amplified and focused on. And certainly the protective benefits of PrEP are absolutely amazing. And people, although side effects is a concern, it's something that we watch closely and people shouldn't dismiss it if they need it.
And as you said, of course, side effects are something that anyone should be concerned about. You're taking that opportunity to make sure that patients are set, but your real concern is the chilling effect that this would have of folks who might benefit from the PrEP program, from the PrEP drug, might be opting out because of what they're seeing in social media.
Absolutely, and we published some of this last week, and I just want to make a shout out. The study was actually led by Dr. Amy Nunn and Will Godell over at the Brown University School of Public Health, so I just want to make sure that they're acknowledged in this.
Well, again, I appreciate your coming in to, again, bring this to people's attention, and we'll actually probably provide an image of what that ad looks like as well, but wanted to kind of talk through this. And while we have you in here, you know, 2020, it's February, what lies ahead for you, especially in the field of PrEP and HIV prevention? As you said, how much of a game changer is this drug?
Yeah, so to back up, the way that we're going to end the HIV epidemic is prevention and testing too. And so for people that are HIV positive, getting them on timely medications to make sure they're undetectable. Once people are undetectable, they are untransmittable. U equals U, and that's been a major theme along with PrEP. To really end the HIV epidemic, what we need to do is get these advances out into primary care. And as anyone who has tried to access primary care, it can be a challenge in terms of getting into your doctor. We are super excited about a new clinic actually we're opening up called Open Door Health, odhpvd.org. It's focused on the LGBTQ population. PrEP is going to be part of it. So check that out if you have time.
Okay, well, I appreciate you're here coming for the public education campaign, letting folks know again about these ads of concern on social media and why you say, listen to the doctor, listen to your healthcare professional, and make informed choices. So doctor, I really appreciate your taking the time to come in.
Thank you very much.
And thank you for watching us here on GoLocal Live. We'll be back, of course, with more news, lifestyle, politics, and sports from downtown Providence and beyond. I'm GoLocal News Editor Kate Nagel.